Hi, today we will be discussing about the tests required for male infertility and why they are needed. Because many times we spend a lot of time in our OPD explaining about the tests and the need of those tests and what is the outcome of those tests. So now in generally whenever somebody walks into your OPD with low sperm count or some sperm abnormality, we will be doing couple of tests. One is a blood test, which is where we do hormonal evaluation. We do generally hormones like FSH, LH, prolactin, testosterone, estradiol and thyroid. These are the tests, these are the basically hormones which control our sperm production in the body. Some of them are produced in the vein and some of them are produced in the testis. So now these hormones will tell us what exactly is happening with the production. And the second test what we do is vitamin deficiency test. Generally vitamin D deficiency and vitamin B12 deficiency can lead to infertility. So generally we do these tests, vitamin D and B12. And the third test what we do is semen analysis, semen test. Basically in semen test there are multiple tests like semen analysis, semen functional assessment and semen ROS assessment and semen culture. So regular semen analysis will tell us how many sperms are there, how many of them are active and how many of them are healthy. We won't be knowing about functional assessment of the sperm in semen analysis. Semen analysis is a basic test, but for semen analysis, for giving semen sample, you have to come to the clinic or diagnostic center with minimum of 48 hours abstinence or at least 3 days of abstinence. Minimum, if there is abstinence of 48 hours from previous ejaculation, that is more than enough. So then second important thing what we have to note down when you are giving semen analysis test is partial ejaculation will not help. Whenever you are giving semen analysis, you have to collect the entire sample for semen analysis test. Suppose if some amount of semen has fallen down while collecting semen sample, it is always better to avoid the test, come back after 48 hours and give one more sample and try to collect the entire semen which is coming out, not only few drops. Few drops is not enough for testing. Whatever it comes out, we have to collect the entire ejaculate and give for sample testing. And while giving sample, you should not use any lubricant or local lubricating gel or shampoos or soap on the penis, so that this can actually cause impaired assessment. And semen culture test will tell us what exactly is the problem or whether there is any infection in the semen, and if there is any infection, what kind of bacteria it is and what kind of antibiotic works well for that particular bacteria which is identified in the semen culture test. But for semen culture test, you don't need any abstinence. Even if there is 1 hour abstinence, you can give for semen culture. And with same sample, we can do semen analysis and semen culture. So now next test for male infertility is DNA fragmentation test. In DNA fragmentation test will tell us whether the sperm internal DNA is enough to fertilize or not. This is an expensive test. Generally we don't do it for regular assessment, only in case of long term infertility or only when there is history of miscarriage, early miscarriage or previous history of congenital babies, congenitally abnormal babies, then we do DNA fragmentation test, or when there is family history of infertility, then we do DNA fragmentation test. And the last test what we do is scrotal Doppler scan. Generally scrotal Doppler scan will tell us what is happening in the testis, whether the testicular health is okay or not, whether there is any infection in the testis or the sperm tube, or whether there is any varicocele in the testis or not. this scrotal Doppler will tell us. There is one more scan generally we try to avoid in the initial stages is transrectal ultrasound. Transrectal ultrasound should be done when there is persistent infection in spite of multiple antibiotics. If your infection is coming back again and again, then to know why this infection is coming back, we do transrectal ultrasound. Second reason is if your volume of the semen is very low, that means if you are ejaculating only few drops, then to rule out obstruction at the level of prostate or to rule out chronic infection in the prostate or seminal vesicle, we do this transrectal ultrasound. These are the common tests we do for male infertility. Apart from this, generally we do genetic testing, but in the initial stages we are not supposed to do these genetic tests because they are very expensive and insurance won't cover these tests. So later stage, when there is no improvement with medical treatment, that is the time we have to do genetic assessment.